With modernization and industrialization, the need for transportation has increased in our country. The number of vehicles of all categories on both urban and rural roads has multiplied tremendously in the recent past, and this has resulted in large number of road traffic accidents and head injuries. Road traffic accidents and head injury. Is road traffic accident a big problem in India?
Definitely, it is a very serious problem and a very big problem because in the last few years, with the increase in the number of vehicles that we have on the road, there is more exposure of people on the roads now. Consequently, the road accidents are also on the increase. And in recent years, especially in the last 10 years, India and many of the Indian cities are seeing a huge increase in the number of road deaths and injuries. In 2015, in India there were nearly about 5 lakh road accidents in the country as a whole, out of which about 150,000 people died. Similarly, if you look at what's happening in Karnataka, about 10,000 people have died. A city like Bangalore, we had about 750 deaths. For every death, there are at least 30 to 40 people who are hospitalized.
That means in 2015, 60 lakh people in India, 4 lakh people in Karnataka, 30,000 people in Bengaluru were hospitalized due to road traffic accidents.
So, in terms of the burden of road traffic injuries on the country as a whole, it's a very, very serious problem. It not only results in deaths, but huge amount of hospitalizations and minor injuries for which people have to seek care.
Who are these people dying on the roads and getting admitted to hospitals following the road traffic accident?
Well, that's a very interesting aspect. If you look at what's happening in the country in terms of deaths and other disabilities, the age group of, nearly 15 to 45 years is the most productive and the most resourceful segment of any society. And Indian society is no exception to that. Unfortunately, the people who are killed, injured, or disabled in road crashes are predominantly young people. It is people in the age group of 20 to 40 years who sustain road crashes in very high numbers, and then either many of them die on the spot, or they die on their way to hospital, or during the stay in their hospital. The second important issue is it's the men who are affected in very large numbers. The third more important issue is that if you look at the Indian data, it's very clear that only 18% of deaths they occur in cities, but 82% they occur in rural areas. And the problem in rural areas are very different compared to many other categories. One more important aspect is that most of the people who die in road crashes or who get disabled due to road injuries, they're all poor and the middle income sections of the society. They also suffer more because they can't afford quality care in bigger hospitals. They don't have money to spend on treatment. They lose their job. There are many other things that happen along with road crashes.
Why are these road traffic accidents and deaths or head injuries happening?
A country like India is undergoing a huge change. We have increasing motor vehicles, we have increasing road expansion, infrastructure development, migration where people are coming from rural areas to cities. So there is a huge change in the environment in which we live in the last few years. Road crashes, they primarily happen because of this complex interaction that takes place between a human being, the vehicle in which he is in and the environment he is traveling. Not only it's he, it's also the person on the other side. Sometimes, the other person comes and hits you, because of which you get injured. Most of the times, if you look at our government reports, it commonly says it's human error, it's negligence, careless driving, rash driving, nonsense driving. These are all the words that are commonly used. But the science in the last few decades has told us very clearly, it is not just blaming the individual, but there are so many things around us on the road that can lead to road crashes.
What are the human factors that contribute to road traffic accidents and head injury?
Everyone thinks that the entire road belongs to him. It's almost his personal property which he can use in any way he or she wants. But there are certain issues where when people have to be safe to protect themselves when they are on the road. And these have been very clearly identified by research, including the research that we have done at NIMHANS over time. To give you some examples, the safety factor when it comes to road crashes depends on the road user, but varies from road user to road user. For example, one of the commonest things that we see on the road is violations of the traffic rules. People don't drive in the way they have to drive. There is always overspeeding, there is always overtaking, there is always sudden jumps. We jump at the traffic lights, you jump at signals, you don't stop at the intersections. The variety of traffic violations we see around us. It can lead to more grave consequences from road crashes. I'll give you 2-3 specific examples. For example, if a two-wheeler rider, if he is not wearing a good quality helmet that is properly strapped and which is really fitting into the size of his head, then his head is directly exposed to a traffic. And in a crash, his head either goes and hits the opposite vehicle, or it hits when he falls sideways to the ground, to a curbstone or road materials.
What happens when helmet is not worn during road traffic accidents?
Brain inside the skull is likely to be damaged in different proportions and of different nature, which can lead to either immediate death or lead to major neurological disabilities, or it can lead to internal hemorrhage, it can lead to skull fracture, it can lead to a variety of things. So helmet as such provides very good protection in the event of a road crash. So wearing a helmet is one of the safety factors that is very, very important to protect us from death and disability in the event of a road crash.
Do not drink and drive.
To give you one more example, it's common now, in most of the places in India where alcohol is freely available, it's common for people to drink and drive. And this, studies we have done at NIMHANS has shown that nearly about 1/3 of the road crashes, they occur during night times, and 1/3 of these are directly linked to consumption of alcohol. So when a person is under the influence of alcohol, he will have a lot of difficulties with regard to judgment, with regard to decision making, with regard to use of safety procedures, with regard to his reflexes, with regard to his coordination between eye and hand and what is on the road. So all these things are affected when a person is under the influence of alcohol, because of which crashes can occur in greater proportions.
Always wear seat belt for safety.
Seat belts use among car drivers. In fact, for all the occupants of the cars, every car occupant must wear a seat belt when they are driving. It's to protect them in the event of a crash. They go and fall forwards, their chest and head, they hit the steering wheel, they hit the windshield, because of which there could be internal injuries, external injuries, and they can die. If one is wearing a seat belt, he is held in that position, he will not be tossed around, he will not be thrown around sideways, and his body will not go and hit objects that are around him. In that way, he becomes safe on his own.
Do not talk on phone while driving.
The use of cell phones. When you are using cell phone while driving, and it's very common to see this on our road, in every traffic intersection you will see everyone trying to open their mobile and either send a message or talk to someone or use that. But when they are doing that, when they are driving and using a cell phone, their attention is distracted and they are not able to concentrate on the road. Their attention is split between what is happening on the mobile and what is in front of them on the road. And these situations suddenly lead to more and more crash reasons, especially if we look at all deaths that occur on the road. And if you look at specifically what is it that contributed for the deaths, it's always on one side or the other the issue of speeding. An increase in 10 kilometers speed will result in an increase of 5% increase in road deaths. For example, poor visibility is one. The other one is pedestrians. I mean, all of us, every one of us, we are a pedestrian at some time on the road. And when they are pedestrians, it's important that they face the traffic and walk, or sometimes they walk on the footpath whenever it is available. It's important that they do not cross the road wherever they want.
Apart from human errors, what else will contribute to road traffic accidents and head injury? Contribution by the vehicles and the roads we use. The vehicular factors: increased number of vehicles, powerful vehicles with high speed, poor lighting, unstable vehicles, vehicles made of inferior material, brake failure. The roads in India. Different kinds of roads: arterial roads, highways, rural roads, no footpath for pedestrians, poor maintenance of roads, bad condition of roads during rainy season, poor visibility of roads, inability of roads to accommodate the traffic burden. Roads are not designed for safety of children and the elderly. These increase the probability of road traffic accidents and also the severity of injury. What are the consequences of road traffic accidents?
For example, in many of the studies that we have done at NIMHANS, we have seen people having injuries to the head, injuries to the neck, injuries to chest and abdomen, injuries to upper limbs, lower limbs, spine, vertebral column. Any part of the body can get injured. Commonly, what we see in most of the road crashes, if we take 100 crashes, nearly 50 to 60% of them will have injuries to the head and brain. And that is a very common thing. And upper limbs and lower limbs are involved in about 25 to 30% each sometimes. And there can be fractures, there can be dislocations, there can be muscle injuries, soft tissue injuries. All these are likely to happen. In about around 4 to 5% of cases, there will be injury to the chest, injury to the abdomen, injury to the neck and spinal cord. These things are also very common. But the most important thing in a road crash is the injury to the head and brain. And brain is the most important organ of the human body, which is essential for all activities that we do in our day-to-day life. And brain, when it is affected, it can be affected in very severe, in different ways, depending on the amount of energy transferred and the amount of energy that affects different parts of the brain. It can be a minor injury like concussion, or it can be a very severe injury like hemorrhage inside the brain. It could be a skull fracture or contusive injuries. It could be any of these type of injuries. Even that is enough. It is now proven that nearly 10 to 20% of people with even minor brain injuries will have adverse consequences over long periods of time. So any of these injuries can be very fatal. The person can die on the spot, can die within a few hours, or can die even in the hospital. The longest study that we did for 5 years at NIMHANS on road crashes showed that nearly 1/3 of the people, they die at the crash site, and we call them as spot deaths in common man's language. So about 1/3 of them, they died at the crash site within seconds or minutes. About 15% of them, they die on the way when they are going to the hospital, because hospital to hospital, when there are inter-hospital transfers, there is a lot of time spent on the road in transferring. And nearly about 50% of people, they die in the hospitals. Among those who survive, an injury to the brain can lead to both short-term deficits as well as long-term disabilities. And this can affect many activities of our life like speech, vision, hearing, communication, intelligence, information processing, intelligent work that we commonly do, skill activities that we do, our ability to interact with people in the society. So it can affect person in number of ways. So that's why we say that there are people after a head injury that they find it very difficult, and it takes a long period of time with very efficient rehabilitation programs to get them back into the mainstream. So the consequences are huge and several.
What is head injury?
Technically speaking, head injury is any injury to the head with or without any internal brain injury. However, from a public's point of view, from a layman's point of view, head injury is a catastrophic event. It is a devastating event for the family. Why I say so is that usually your near and dear one who has been absolutely fine and a moment ago, and suddenly he goes out of the house and sustains a head injury, it is a very devastating experience for the family to see him suddenly unconscious, which is usually how head injury patients present. So that gives a little scary picture to the public when the issue of head injury comes up.
How is head injury classified?
Head injury is very simply classified into mild, moderate and severe category. I'll illustrate this by a few examples. Let's take an example of a young man who is driving a two-wheeler, sustains a road traffic accident and then falls from the two-wheeler. Immediately after the fall, he is a bit dizzy, but in a few seconds only he is able to regain his consciousness. He is able to appreciate what's happening around him. He is conscious, responding to commands of the bystanders and his family members. And in this state, if he comes to the hospital for further evaluation, we will term it as a mild head injury patient. Now let's take another example in which again a young man who is driving a two-wheeler sustains an accident. This time the accident was a little more severe because maybe he was driving at a little higher speed. Immediately after the accident, he is deeply unconscious. Even after a few minutes, he is not responding to the environment, to the bystanders and to the family members. When he comes to the hospital, at that moment also his consciousness level remains the same. He is deeply unconscious. He is not responding to what the paramedical personnel and the doctors are asking him to do. Such a patient would fall into the category of severe head injury. Now these are two cases at the ends of the spectrum. Patients who fall in between these two ends of the spectrum are usually termed or usually categorized as moderate head injury.
What are the clinical symptoms of head injury?
So when it comes to symptoms, patient usually will have visible telltale signs like bruises, cuts and scratches. Other than these visible signs, the most important thing to look in a head injury patient is the consciousness level. Very simply said, consciousness level is something how the individual is responding to his environment, to what the people are talking around him, what is being asked to him. If he is giving relevant answers, he usually has a good consciousness level. Whereas a deeply unconscious patient will not respond to any of the environmental or questions asked by bystanders. The other symptoms of head injury, which are not rare at all, are headache, vomiting. Sometimes these individuals can have fits also. There can be bleeding from the nose and ear. Rarely patients can present with paralysis also.
What do the doctors do when head injury patients come to the hospital?
At our first point of contact, our first aim is to stabilize the patient. Stabilization means that we should ensure that the patient is breathing normally, is having a good circulation, that is, his blood pressure is normal. If that is not so, the first steps would be to establish breathing and make sure the patient has adequate blood pressure by giving fluids or sometimes blood. We need to stop the bleeding, active bleeding, which may be occurring in these patients. These are all the steps which we take to ensure that the patient is stabilized.
What is the next step?
The next step is to subject the patient to a CT scan. In simple words, CT scan is like an internal photograph of the brain. It is this important investigation which will decide the next line of treatment. For example, if on CT scan the patient has a large blood clot sitting inside the brain causing significant pressure on the brain, patient will be rushed to the operation theatre for an emergency surgery. The neurosurgeon will remove the blood clot, and this will allow the brain to expand and return back to normal function. In another example, the patient may have a normal CT scan, that is, the brain is appearing normal, or the patient may have few small blood clots, or patient may have a little swelling in the brain. In all these situations, the patient has to undergo strict regular observation in an observation ward, and during this period of observation, patient may need few more CT scans to determine the next step. In these patients, it is also very important to rule out a coexisting spine injury, and this also will be done by radiological investigations like X-rays and CT scans.
What are the measures taken by the government regarding road safety and prevention of road traffic accidents?
Well, see, in the last 10 years, road safety has become a major issue in India. And especially at all levels, there is now a very growing recognition that road accidents should not happen. Young people, they should not be killed in road crashes, which are mainly predictable as well as preventable. Both can be done. Government has taken very serious note of the growing number of road accidents in India. Successive governments have tried to bring in several changes. Mainly, road accidents are handled by 3-4 methods, which we call as the E's in road safety. E means the English alphabet E. And these are basically referred to as education, enforcement, engineering, and emergency care. These are the 4 E's. And the government has been trying to bring in reforms and changes in some of the areas that will be very important. For example, we have seen in recent years the enforcement of road safety regulations and the legislations that are there in the Indian Motor Vehicles Act are implemented or enforced to a much higher level compared to what it was 10 years back. Whether it is with regard to for not wearing helmets, not wearing seat belts, going at very high speeds, or using cell phone while driving, or jaywalking even at times, all these are all being addressed through legislation and enforcement, where the principle is just very simple, that unsafe behavior should not be tolerated. On the other hand, there are also some education programs which tries commonly to inform public that you have to be safe on road. So you will see many banners, posters, pamphlets, songs, videos, everything done which says you have to be safe on roads, speed kills but thrills, wear helmet and be safe. Slogans like this which give information to people that they should be safe. But giving information as such does not translate to practice. We also have the third E, which is the engineering, where there is changes that are being made in the design of the vehicles, in the way vehicles are being manufactured today. they are made much more safer. India is also introducing the India cap program. The Euro NCAP program is there in the European countries. Many other countries have vehicle standards. So India is also gearing up with regard to vehicle standards in that direction. Simultaneously, we also have many new developments and technologies being used in road infrastructure development, maintenance, operation, sustainability on all these issues. And emergency care, especially the Ministry of Health, has taken a lot of measures in recent times to improve that emergency care is available for people with road crashes. In fact, there are pilot studies that are going on where cashless scheme to treat accident victims is currently getting some amount of recognition. So in Karnataka, we have the Harish Santwana scheme, which is where any person can go to any hospital, but he has to be treated, and the government, for the first 48 hours, the cost towards that will be reimbursed by the government. So emergency care is also going up. There are more people being trained in emergency care. Many emergency medicine departments are coming up. The 108 ambulance services are being improved. So a lot of these things are happening. So, but the most important thing is, whatever we are doing now is not matching with the amount of problem we have in our hand. We need much more scaled up efforts, much more very advanced interventions, and we need to move from active to passive interventions where people are made safe on the road.
What is it that people need to do to be safe on the roads?
It is the duty and responsibility of each one of us to be safe on the road. And we need to take all measures that we can take to be safe on the roads. In a country like India, where nearly 75% of the vehicles are just two-wheelers, one of the important things that every motorcycle rider, we have both the rider and the pillion must wear good quality standard helmets, and they should always be strapped when they are driving on the road. Most important thing to realize is, in the event of a crash for a two-wheeler, it's the helmet that protects his life.
Always wear helmet while driving. Always wear seat belt while driving.
Second important thing that people must do is, if you are a car driver or if you are a car occupant, don't forget to wear your seat belt. And especially in car, it's important to mention that parents should not carry young children in the front seat of the cars.
Do not drink and drive.
The issue of alcohol. Alcohol can distract you, can make you lose your reflexes, can affect your vision, can affect your coordination, can affect your judgment. So never drink and drive.
Avoid overspeeding.
The fifth most important issue is speed. Speed beyond a particular limit is the most dangerous thing. So people say that we enjoy, but that enjoyment can really take your life out. So never speed beyond the prescribed limits.
Talking on phone while driving.
Don't use a cell phone when you are on the road and if you are driving. And again, it's very important that cell phone can distract you, and that distraction can lead to a road accident.
Pedestrian safety.
Especially if you are a pedestrian, you need to be extra careful because no vehicle driver will care for you when you are on the road. You need to do 3 4 things which are very important. One is always walk by facing the traffic. Do not go on the other side by showing your back to the traffic. You have to face the traffic. The second important thing is if you are crossing the road, cross the road at designated places, at defined places where there is a mechanism for you to cross when the vehicles come to a stop. And it's equally important that vehicle drivers should respect this law. It's not that when people are crossing, people are driving at high speeds. So cross the road at designated places. Number 3, use a footpath wherever and whenever it is available. We don't have footpaths in many places, but wherever it is available, use a footpath. The next important thing is be visible on the roads. It's always strongly recommended that in many countries people are encouraged to wear bright reflective clothing, bright reflective colors of their vehicles, road markings that are bright and visible. So you as a pedestrian also can make yourself little more visible on the road when you are there. And fifthly, if you see children, if you see disabled people, if you see sick people, help them in using the road.
Prevention is better than cure.
Some of these things are important for people to be safe on the roads. Whether there is a law, there is no law, whether somebody enforces or somebody doesn't enforce, you get a ticket or you don't get a ticket, that doesn't matter. All this you are doing for your own safety, and you have to make yourself safe on the road. Otherwise, tomorrow there will be a huge regret that can come at the cost of your life and at the cost of your family. What helmets to wear, what seat belts, drink drive, all these are road safety regulations, and these regulations are made for the safety of people, and it's important that people understand and adapt these safety practices in their day-to-day lives, and that will save large number of deaths, that will prevent large number of deaths that are taking place on our roads.